Hi everyone, my name is Nitin Chhoda and welcome to the State of Private Practice in 2012. Now as we head towards the end of the year in 2011, it's a time for great celebration, it's a time for holidays, but it's also a time to step back and take a look at the precarious situation that we find ourselves in as private practice owners. Every year there's talk of declining reimbursements, threats in Medicare pay cuts. We hear about the importance of setting up new cash paying programs. We hear about the importance of strategic alliances, of getting doctors and patients to refer. But I think it's important for us, if we want to succeed in 2012, to take a step back and look at exactly what motivates doctors and patients to refer. Traditional advertising and traditional marketing has always been about, hey, take a look at me and take a look at how wonderful I am. If you take that a step further and you actually tell the patient or the physician, here's what I can do for you. And if you take that a step further and say, I'd like to help you make a decision about the best solution for you or the best option for you as far as pain relief, as far as getting stronger, as far as recovering from injury is concerned, then that's when you start to become a successful private practice owner, because now you're working on your practice as opposed to in your practice. Now, if you've ever watched American Idol, some of the brands advertising in American Idol, like Coca-Cola, like Singular, they take this marketing to an entirely new level. Instead of having ads and advertisements in between the show, during the intervals between the segments of the show, like Ford did, what Coca-Cola and what Singular did was they had ads inside the show, strategically placed inside the show. For example, the American Idol judges would actually drink water from Coca-Cola bottles, from Coca-Cola glasses. The red and white colors were strategically sort of implemented throughout the show. Singular became a part of the show because they were the text messaging provider if you had to vote in American Idol. So the point I'm trying to make is marketing has to be structured in such a way that it becomes part of the fabric of what the individual is consuming. For example, let's say you're sending out a newsletter. If you're sending out a text message giving patients a tip on how they can get stronger, how they can get healthier, how they can live pain-free. If you're sending patients a letter, if patients get a phone call with a tip on what they can do on to get healthier faster, that becomes the fabric of your message to the patient and indeed to the physician, and that in turn can contain subtle marketing messages. So again, marketing is not about, here, take a look at me, I'm wonderful, I'm a nice person, I'm a nice therapist, I went to school, I'm good at what I do. The fact is, we all are good at what we do, but marketing is more about what I can do for you, and more strategically, let me help you make a decision about the right choice for you. Let me actually illustrate this so you'll get a better idea of what I'm talking about. Now, traditionally, if you want to get more referrals in your practice, you have the patient, and of course you have the doctor, and here you have the practice owner, which is you. Now, your goal as a practice owner is to get the patient and the doctor essentially come to you. The doctor sends the patients over to you, or the patient now says, I'd like to choose you as a physical therapist, as a provider of choice. This is your goal. The mistake that most private practice owners make is trying to market to the doctors and say, send me patients, or they keep telling the patients, send us more referrals, send us more referrals. This again is a form of direct marketing. It's not a form of strategic marketing. Like I mentioned, some of the advanced brands out there. I mentioned the examples of Coca-Cola and Singular, like they do. What you want to do is you want to try what I call the third dimension approach. And this is what you need to do in 2012 if you really want to be successful as a private practice owner. You do need to communicate with the doctors and with patients, but you need to communicate with them in a way that gives them important information on pain relief, on injury prevention, on getting stronger, on getting healthier, but ties that information in a way that they now know and they now see that physical therapy is what's going to get them there. So that's what will bring them back to you. Imagine if you're sending a newsletter, like I said, if you're sending text messages, if it's, calls or, voicemails that you leave with doctors, or, if it's letters, right? And, these newsletters can be email newsletters. Any which way you get the information across to the doctors and the patients, your goal is to provide them with valuable information that helps them make a decision about two fundamental questions. How do I get relief in pain? Because, the doctors need to understand that when it comes to pain relief, physical therapy is the best choice. And secondly, how do I improve function? How do I get stronger? How do I get healthier? How do I improve flexibility? If you can convince doctors and patients that, that physical therapy is the best choice by way of educational messages, educational resources, and a newsletter is a great way to do that. Now you're getting them to start to think about what physical therapy can do for them, and that's what's going to lead to more referrals back to your practice. So I hope you understand strategic marketing is about what I can do for you, and let me help you make a decision. Remember, at the end of the day, doctors want to know how they can help their patients get better faster. And, we're not talking, vested interests like their own clinic or their affiliations with hospitals. We're not talking about any of that right now. We're talking about how you can get in touch with doctors more strategically, more intelligently than any other private practice owner out there, so that you can get into their mind space. Marketing at the end of the day is all about getting into someone's mind space, about getting them to think about you and reach their own conclusion about you. Marketing isn't about me, send more patients to me. That is the old way of doing things. In fact, these days, doctors and patients are completely overloaded. There's just too much. There's the age of the internet, there's iPads, there's droids, there's just so much technology out there. There's Facebook, there's so many things. It's hard to get the attention, most certainly of the patient, because the patients are busy. They're busy in their lives emotionally, psychologically, professionally. They have too much going on. So for you to just expect the patient to refer to you is unrealistic. The same goes for the doctor. Doctors are busy people. For you to just expect them to refer to you because you're a good therapist, that's not the way private practice is going to be in 2012. Private practice in 2012 is going to be dominated by the owners, by the business owners who understand the importance of strategic education-based marketing using different forms of media, like email newsletters, like text messaging, like actual calls and voicemails, letters, and even personal visits to the doctor's offices. Again, the private practice owners who dominate, who are successful in 2012 are going to be using different forms of communication to reach doctors, to reach patients, to help them make a decision about what's best for them as far as pain relief and getting stronger, getting healthier, and recovering from injury is concerned. And what is that option? That option is physical therapy. I hope this has helped you. And if anyone else needs this information, please have them come and watch this video. And I appreciate you taking the time to watch this. I wish you all the very best for your private practice in 2012. And together, we'll make the coming year the best year for your private practice. Thank you so much for watching.